I am Kathy Coy. I am a certified dental assistant and a registered dental hygienist, and I teach dental assisting here at Wallace State Community College. Responsibilities of an assistant, if you're thinking about going into this as a profession, is mainly assisting the dentist in the procedures he's going to do and having an understanding of how these procedures are done so that once he starts the procedure, you have everything out that he's going to need. And how to take x-rays. If you need to take x-rays, he'll delegate those to you. And then there are additional expanded duties that you will do, such as taking impressions, making temporary crowns. You could remove sutures after surgery. So then there's other areas of dental assisting also that you can do in a dental office. If you're not interested in chairside assisting, you could also be an assistant that works in the business part of the office. Your duties there would be to greet patients, maintain records for those patients, getting medical histories when new patients come in, filing their insurance, collecting fees. It's a low-stress job, which makes it very appealing to some people. The best part of being a dental assistant, I would have to say, is developing a relationship with your patients and offering them the care. One of the things that I miss most about private practice is the relationships that I built with my patients and their families over the years and getting involved in their lives. The variety of tasks that you do. Dental assistants, you might be doing a filling 1 hour, a crown prep the next, a root canal. So there's a variety of tasks that differs from a dental hygienist who basically stays in the same room and performs the same task all day. And then I'd have to say another best part is the working hours and the days. If you want to work part-time, a lot of offices are only open 4 days, and that gives you an extra day during the week to get things done, do things with your kids. And then it's a clean environment. It's just a nice environment to work in. The worst part of the job, I really can't think of anything that's really bad. If I had to pick something though, I would probably say the pay is going to be a little less than, say, the hygienist in the office makes. There's a reason for that though. The hygienist has extra education. She's delivering more of on-one care to that patient and responsibility for that patient. So that job does tend itself to have the higher salary. But there are some fair pay in dental assisting, and a lot of offices now are offering 401 benefits. Dental assisting students that come into our program are taught infection control procedures, how to do medical histories, take vital signs, learn instrument identification and how they're used in procedures, how to take x-rays, and we teach both digital and regular x-rays. And then they take courses in nutrition and dental health education. Then after this, they'll also take courses in office dental procedures. Requirements to enter an accredited assisting program varies program to program, so I would recommend checking with the program in which you're interested in applying and see what the requirements are. Most, though, do require a minimum GPA of your previous classes, and it usually takes about 12 months for a certification. An associate's degree can be earned most of the time by taking some extra classes, and these would possibly include math, biology, English, speech, and psychology. The program will include at least 300 hours of clinical experience in an office or clinical setting where the students can perfect their skills. Students are qualified then to take the Dental Assisting National Board, known as the DANBY, and each state, again, has different requirements of what certification level they want you to have. So I would again check with the state in which you'll be working and see what they require from the DANBY certification. The advice that I would probably give for someone that's looking into going into dental assisting as a career, first of all, would be to keep your grades up for admissions. Again, check the requirements that you need. If they require like an ACT exam, you would want to take it and make as high as you could on it. The other advice, and probably the most important, I would say, would be to spend time observing in an office to see exactly what happens in a dental office, what a dental assistant does, because so many students get into the program and decide that dental assisting is really not a good fit for them. So with all the knowledge you can have before you actually come into the program, the better off you'll be.